right now. Also, I'm going to check around the wound, make sure that I haven't left any pieces of tape, anything like that, and go ahead and gently remove those at this time. I'm making sure I'm counting those dressings as they come out and throw them away. I'm making sure to note if they're dripping, draining, what's on them, if there's any smell to them. All these things we're going to be noting. Now I'm going to get rid of these gloves because I've touched that dressing. I'm going to perform hand hygiene again and put on some more clean gloves. At this point in time, too, I'm not recontaminating or anything, and I'm also touching some of my other supplies. I've already done quite a bit of the things that you're going to see in step 26, which is inspecting the wound for the color, the exudate, the integrity, anything that I'm wanting to know. Also, I'm checking around the skin to see if there's any redness, streaking, anything like that. I can, without getting right up on it and smelling it, I can assess it for odor. This is the part where we're going to measure. With the wound measuring guide, it makes it fairly easy. You want to measure at the longest and the widest. And this is why you want clean gloves on at this point in time if you decide that you want to jot it down right now. This is also the point in time, if you've got a very deep wound, that you want that extra set of cotton applicators, cotton-tipped applicators. Because this is when we're going to measure the depth of it. We can check for tunneling and sinus tracts, things like that. And when all else fails, you rip them open like that. What you can do, if there's different depths, you're just going to take it, touch it down, bring your finger down to where you know that the edge of it is, and then you're just going to hold it up to the wound measuring where you can see the depth of it. Also, you can take it if there's any tracks, check for undermining at this point in time, because this is still a sterile Q-tip at this point in time, a sterile applicator at this point in time. When you get finished, you also want to put those in the disposable bag. And you've measured the wound. You can also go ahead and jot those numbers down at this point in time. While you're doing all this, don't leave the patient out of it. Explain to them that it does look like it's healing. There's granulation tissue. Keep the patient informed. It looks better today than it did yesterday. Anything that you can do to kind of comfort them. At this point in time, we're going to start on the sterile part of the procedure. We've documented, and we've got everything sitting here. So, if we needed to re-perform the hand hygiene and put on new gloves, we would, but our gloves are still clean. We make sure we've got the tape. We're going to have to be accessing our sponge gauzes while we're sterile, so we need to just open the top of those. Set those over there. Our abdominal pad, we'll have to get a hold of it while we're sterile. Just going to lay it open just like that. Our suture removal kit, or whatever we have our forceps in, we need to make sure it's open and accessible. We need to open our bottle. We've checked our date. If this bottle had been open, what we could do, if it had been open within 24 hours, we could do what's called lip the bottle, which is basically take it and lip it. It just gets rid of any contamination on the seal that is. And at this point in time, we're going to saturate those 4x4s in their container. Because we're still clean and not sterile, we can recap the bottle at this time and set it over to the side, kind of out of our way. We've got our suture kit open, we've got our ab pad open, and we've still got the applicators closed, but we're going to show you what you can do with those. Okay, that's everything that we can get right now. So, we're going to perform our hand hygiene, remove our clean gloves that might be soiled now, perform some hand hygiene, and we're going to get ready to put our sterile gloves on. So what we can do, we open up our sterile gloves. And we can take these and dump them onto our sterile field, because the inside of that is still sterile. We can touch the outside of it and move it as we need to, and remember, an inch around it is a safe area. You now have a sterile glove. You can just pick these up with the sterile hand and move them now. Okay, and we've got everything we need, and we also have a sterile field right here as well. So we've got our gloves on. We're going to start just cleaning the wound now. We're going to pick up one of the 4x4s, and we're going to wring it out where it's not just soaking wet. And that should have stayed open, so I would ask my fine assistant to pull it back again. So we did that, and we stayed sterile. And just taking the wet one, you're going to pick up the forceps, and you're always going to clean from the least contaminated to the most contaminated. You don't want to recontaminate this wound bed. So we're going to take that and go down it. Drop that in the red bag. Repeat it again, going along the edges. Drop it. And we're just maintaining that we're sterile at the entire time. And clean again. And drop that in it. At this point in time, we can drop the forceps in there. We're finished with the forceps because we have cleaned it. Okay? Now, the 4x4s, you're used to seeing them in that nice little pad and everything. We know that we had 2 that came out of it. So keeping it sterile, we're going to kind of unwind it a little bit and wring some of the excess out of it where it's still wet, but it's just not dripping all over the place. Very carefully, without touching the edges, we're going to repack that wound. We don't want to touch the wound and lose our sterility of the gloves. As the wound heals, we'll need less dressings, but we're going to go on and pack back in too. Now this is the point in time where your applicators can come in handy. When you get to this point and you need just a little bit of help tucking them down in there, or maybe you need to pack some sinus tracts or something like that, you can take the Q-tips, the sterile applicators, and kind of pack the wound down in there, just like that. And that way you can make sure there's a moist surface in touch with every part of the wound. The idea is that you want to keep that dampness in touch with every exposed portion of it. And once you do that, we're finished with the wet. So we're going over here and we're picking up the ABD, or the abdominal pad. There'll be a blue stripe. This one's kind of real faint on it. Blue stripe. You're going to want to cover the wound with that. Okay. Now at this point in time, we've covered the wound, so the sterility of our hands is not as big an issue now. So we're going to tear our tape. And without a doubt, the tape's going to tear just like that. And if that happens, you just fix your tape, or you go